So very good afternoon to everyone. Is the audio video clear? Can you reply me in the chat box? Is the audio video clear for you? We are having a Telegram group for interaction with the teacher. So we have a new Telegram group. So you can interact with me once the audio video is clear for you. Good. Diksha, is it clear for you? Kanishka, you're typing something. Good. So it's good if everyone, those who are enrolled, can join the Telegram group. So we are starting the subject, very important subject. Good. Preventive and social medicine. So I'll be discussing all the important chapters for you in sequence. So the first chapter is very important, that is health indicators, where you'll be learning all the important questions, previous year topics, and very important updates in this chapter to be known. So first chapter, make chapter heading health indicators. So can you reply me in the chat box? Are you noting down what is being shown there? So first chapter, what we are discussing is health indicators. So in this chapter, initially when we start, we'll be starting with the basics. So we are having three entities, how to differentiate between three things, like we have rate, mix subheading, good, rate, ratio, and proportion. So the first subheading will be rate, ratio, and proportion. So when you have a fraction, we are having two parts in a fraction. Now, those who are there in the chat box, you have to interact with me at the same time, write the notes. It's a two-way interactive session. Now, it's not the recorded session. It is the live batch, online batch, so you can ask anything to the teacher and the teacher can coordinate with you. The communication has to be continuous. So the first subheading is rate, ratio, and proportion. So the numerator has two parts. For example, make subheading rate now. In rate, numerator is a part of the denominator. Write down this point. Good. Numerator is a part of the denominator. As in a fraction, we are having two parts. One is numerator, the other will be the denominator. Here when you write something in the numerator and denominator, within rate, numerator is a part of the denominator. So when you compare two things, you are comparing two same entities or different entities. Answer my question. Good. Answer my question in the chat box. Good. Comparison between two same entities or different entities. Bhagat. Comparison between two same entities or different entities. It is two same entities. When I give the example, you will understand. Different entities will become ratio. But when you compare two things, two same entities will become rate. Always an event which changes with respect to time, like crude death rate, infant mortality rate, crude birth rate, those things they change with respect to time. So it is an event which changes with respect to time. So write down the points. Good. It's an event which changes with respect to time. For example, x-axis you are writing time, y-axis you can show anything like infant deaths in our country, birth in our country, deaths in our country, how they change with respect to time. Very good, good. Now you are replying to me, very good. Almost the students have joined the group. Yes, good. So example now. Example. So there are formulas. For example, if I am telling infant mortality rate. So there is a formula to write infant mortality rate. Now, what is the numerator? What is the denominator? Answer my question. Numerator will be infant deaths. Any deaths which happen within 1 year. Denominator has to be same entity. If I take the denominator as reproductive women, something else will happen. So denominator has to be same entity. So what will be the denominator of infant mortality rate? Answer my question. Good. What will be the denominator of infant mortality rate? Yes, correct. Live births. We compare same entities. Denominator has to be live birth. So, for example, if I take 1000 live births, how many infants will die? Means how many will die within that time limit, within 1 year. So, for example, if I take 1000 live births, the recent infant mortality rate of our country is 28. Write down this point. 28 per 1000 live births. Good. So what is the current infant mortality rate of our country? Answer my question. Type it in the chat box. Good. What is the recent infant mortality rate of our country? 28. So it is decreasing always. 32. Now it is 28. Slowly it is decreasing. Infant mortality rate of our country is decreasing every year. That is very, very important point. So the recent infant mortality rate, I want you to type in the chat box. And what is the denominator of infant mortality rate? When you compare the unit of infant mortality rate per 1000 live births. For every 1000 live births, how many infants are dying? That is the recent value. Good. So, what is the reason why infant mortality rate of our country is decreasing? Anyone? Can you tell the answer? Why infant mortality rate of our country is decreasing? Very good. Binesh Virappan, good. Why infant mortality rate of our country is decreasing slowly? Because India is becoming richer and richer. Obviously, if income is increasing, if socio-economic status of a country is increasing, infant mortality rate will decrease. Write this point. Good. If income is increasing, infant mortality rate will decrease. Very good. So what will be the relationship between income and infant mortality rate? Is it positive correlation or negative correlation? Answer my next question. Very good. Very good. Tell me good. If I am asking this question, if income and IMR is related to each other, how they are related? Positive correlation or negative correlation? If they ask this question, both of them, they show negative correlation in between them because one is increasing, the other is decreasing. Very good. Negative correlation. Very good. Because one is increasing, the other has to decrease. Infant mortality rate can indicate socio-economic status of a country. Answer my question. True or false? Infant mortality rate can indicate socio-economic status of a country. True or false? You have to reply me. I will give time for you to write the notes. It's more about interaction with the teacher. That energy what we are sharing in between, that is the use of this live batch always. Recorded session you'll be watching on your own, that has its own advantages. But when you're with the teacher, the retention and the recall part is very, very, very important. Now answer my question. Very good. True. What was the statement which I told? Yes, it is true. It is an indicator of socio-economic status. It is an indicator of socio-economic status. Very good. So write all these points. All these are very, very important points what I am writing. So once you copied all these points, let me know in the chat box. Yes, sir, I copied. Give the response. Yes. So that I can go to the next example. The first example of rate is infant mortality rate. The formula infant deaths divided by live birth. When you are comparing two things, I'll tell you how to calculate IMR and all in detail in the chapter MCH, Mother and Child Health. Here what I'm doing is I'm just giving the basic examples of rate. And why it is rate? Because you're comparing between two same entities. You're comparing between two same entities. So the first example for rate is infant mortality rate. Good. The second example for rate is incidence. The word incidence indicates new cases which can develop in the population with respect to time. Write this point. New cases with respect to time. So how many will develop disease in the future? You have to do a follow-up study. Later I will teach how to calculate incidence, what is cohort study, how to measure and what is the denominator and all. So as of now there are two examples for rate. There are two examples for rate. Very basic examples what I am discussing. Tell me good. Infant mortality rate and incidence. Infant mortality rate and incidence. So I want everyone to type this. There are two examples for rate now. Tell me good. There are two examples for rate. One is infant mortality rate. The second one is incidence. Incidence. So there are two examples of rate. So did you copy all the points? Later I will discuss how to calculate incidence in detail. First let me know that everyone in the chat box, everyone in the class, did you copy all the points which has been written in the slide? I want notes to be complete. I want notes to be proper with all the keywords. We have to balance out the quantity part with quality. It's not just the quantity, it's the quality of the notes which is also very important. You should be recall it. You should be able to recall that in the exam. That is very important. Very good. Second, we are discussing rate, ratio and proportion. So tell me good. Yes, very good. Yoganand, correct. So tell me second thing what I have to discuss is ratio. Rate, ratio. So ratio means two different things. A over B, X by Y. If I am asking this statement, numerator is a part of the denominator. True or false? Think and tell. Very good. Numerator is a part of the denominator. True or false? Think and tell. Rate, it's a part of the denominator. When you are comparing two same things. But here if I am asking numerator is a part of the denominator. True or false? False statement. Ratio means two different entities. Both are mutually exclusive entities. Numerator is not a part of the denominator. When you are comparing, very good, you are comparing between two different entities. Very, very good. So now slowly you are getting used to the chat box, getting used to the session. Live batch means what? You are getting that feeling actually. That is more important to get that feel initially. Na? Good. Comparison between two different entities. Ratio. Give some examples for ratio where you compare two different things. Very, very easy question I am asking. In the class, what you are sitting. For example, you are having one side males, the other side females. For example, I am telling if they are sitting separately, males and females. So both are same entities or different entities? Different entities. There is one ratio to know the number of females per 1,000 males in our country. What is that ratio called as? Very simple question I am asking because here in the class there are different set of students. Starting from second, third, fourth, even intern, post interns, all are sitting in this live batch. So I'm asking few basic questions initially so that we can build up on that. So tell me good, what is that ratio? Very good. Sex ratio. Sex ratio indicates number of females per 1,000 males. Very, very good. Number of females per 1,000 males. So what is the recent sex ratio of our country? As per National Family Health Survey, the recent sex ratio of our country is 1020. This is according to National Family Health Survey 5th round data. Write this word. NFHS means National Family Health Survey 5th round has been completed very recently. If they ask how many rounds has been finished, NFHS 5. What is the recent sex ratio for country? 1020. Usually we get sex ratio from census. Census 2021 has not been done yet. 2011 census was the last thing. So recently done survey, that is National Family Health Survey, 5th round has been finished. That is giving the data for you 1020. So it is number of females per 1,000 males. Number of females per 1000 males. The recent value is 1020. The recent value is 1020. So now tell me, according to which survey the sex ratio for country is 1020? This is my question. According to which survey the recent sex ratio for country is 1020? Good. I want everyone to type now in the chat box. It's about interaction. When you're asking, like if the teacher is asking something and if you're typing that, you won't forget it. You're writing the notes, you're sitting in a Viva session, like, so that everything is covered. The retention part is very, very important when you're preparing for any competitive exam. So what is the recent sex ratio for country? 1020. According to which survey, beta? Good. NFHS, National Family Health Survey, 5th round. Very good. Very, very good. Yes, take this. Very good from me in your chat box. Good. The second example for ratio. The first example is sex ratio. The second example is MMR. Can you tell the full form of MMR, everyone? Maternal mortality ratio. Maternal mortality ratio. The formula, numerator will be maternal deaths. Those who die due to obstetric causes. Maternal death. Denominator has to be a different entity. What will be the denominator of maternal mortality ratio? Everyone? Good. Anyone? Very easy question I'm asking. Different entity. So what is the denominator of maternal mortality ratio? Good. Denominator has to be a different entity. So the denominator will be live births. Denominator will be live births. Correct. Good. Denominator has to be live birth. Yes, correct. So both are different entities. Maternal mortality ratio. Maternal mortality ratio. So the multiplier, when I'm using, it is 1 lakh in our country, not 1000. The multiplier what you're using is 1 lakh in our country. So what is the multiplier for infant mortality rate? Answer my question. What we multiply when I multiply infant mortality rate? Answer my question. When we multiply infant mortality rate, what we multiply with? 1000. But when we are multiplying for ratio, we have to take 1 lakh because very less number of maternal deaths happen in our country. If I take 1000, you'll get a decimal value. So I don't want decimal value. Here I multiply with 1 lakh. For 1 lakh live births, how many mothers will sacrifice their lives? That is what we are checking. 1 lakh live births are there. How many mothers are sacrificing their lives? So if I'm asking this question, the recent value of our country is 97 per 1 lakh live births. 97 per 1 lakh live births. If I'm asking maternal mortality ratio of our country is in 3 digit, true or false? Answer my question. Maternal mortality ratio of our country is in 3 digit, true or false? Good. Everyone. If it is true, you type 2, that is T, or if you type F. So if I'm asking 3 digit, true or false? Good. True or false? 3 digit, no. Last year it was 3 digit, around 102. Now it has come down to 2 digit. 97 per 1 lakh live births. This is the recent value of our country. Maternal mortality ratio. Again I will discuss MMR in detail when I discuss MCH chapter, maternal and child health chapter. Got my point? Good. So 2 examples for rate we discussed. 2 examples for ratio also we discussed. 2 examples for ratio also we discussed. Tell me, did you write all the points what I wrote there? I want you to write the notes also, at the same time answer the question. Both has to be covered in a proper way. Yes, good. So there are two examples for ratio. Sex ratio and maternal mortality ratio. So what we are discussing the first topic, very basic topic in this chapter, how to differentiate between rate, ratio and a proportion. The third thing what I need to know, or what you need to know, is about proportion. Good. So numerator is a part of the denominator. Write this first point. Don't write all these things. This is just to know few things in life lessons. So it is temporary, love is temporary, food is important, yes, basic need. But I want you to write this point. Numerator is a part of the denominator. Numerator is a part of the denominator. Very, very important thing in proportion is it's a pie chart. What you have to remember, pie chart. That is what an imaginary concept what you should have in your mind. Pie chart, like out of 100, how many are having disease in the class? Out of 100, how many students are having disease in the class? Now, if I am doing a survey, how many are having refractive errors? How many are having dental caries? That cross section what I am taking, that will give you prevalence of disease in the class. Proportion example is prevalence. Now tell me, prevalence means existing cases or new cases? Answer my first question. Prevalence means existing cases or new cases? Very good, everyone. Prevalence का मतलब क्या हुआ बेटा? Good. What is present at that point of time? English word. Prevalence means present tense. Will indicate new cases or existing cases. Good. New cases or existing cases? Yes, sir. Good. It is existing cases at that point of time. At that point of time. You have to use this word. Existing cases at that point of time. Good. How many will develop disease in the future? New cases with respect to time will become what? Already discussed that point. New cases with respect to time will become what? Answer my first question. New cases which will develop in the future. New cases with respect to time. What is that called as? Good. It's been written in the notes already. The same thing I'm asking. Third, has that confidence has to grow in you. That is very, very important. Yes, good. New cases means will happen in the future. Incidence rate. What is present at that point of time? That is prevalence. Existing cases at one point of time. That is the first example for proportion. The second example for proportion will be couple protection rate. CPR. Couple protection rate. So what will this indicate? Couple protection rate means you are going and doing survey using couples and asking them how many are using contraception. Couples protecting themselves so that one more child will not come out. Yes, couple protection rate will indicate proportion of contraceptive practice. Tell me true or false. Very easy question I'm asking. Couple protection rate will indicate proportion of contraceptive practice. True or false? Answer my first question. Couple protection rate will indicate proportion of contraceptive practice. True or false? Yes, correct. Because what you are doing is the survey. How many couples are there in that? How many are using contraceptives? You are using a pie chart. It is the correct statement. It is indicating the proportion of contraceptive practice. Again, these things will come in detail in family planning chapter. You should know what is proportion. How many are using contraceptive? Proportion of contraceptive practice in the community. What indicator is used? Very good. What indicator is used to indicate proportion of contraceptive practice? Answer my question. Couple protection rate. Couple protection rate. So two examples for proportion. So we have discussed two examples for rate, two examples for ratio, at the same time two examples for proportion. So I want everyone to type two examples what we have discussed. Yes, IMR incidence, sex ratio, and MMR, and one more is, what is that one more, last two things what we discussed, prevalence and couple protection rate. Come to the next topic. After discussing rate, ratio, proportion, examples each, come to the next topic, that is mortality indicators. So within class you are giving more than 100%, I am telling. You are listening to the class, learning something, writing the notes, replying the teacher, same thing you are replying, so that output has to be higher. It's always about efficiency, I am telling. The input output ratio we have to maintain in our life. So now tell me, mortality indicator indicating death. Very good. Mortality indicators indicating death. So there are different mortality indicators. In total there are 5 mortality indicators what you should know. There are 5 mortality indicators what you should know. This is the next subheading, mixed subheading, mortality indicators. So the first mortality indicator in this will be life expectancy. The first mortality indicator what I'll be discussing is life expectancy. Means every country is having its own amount of living, na? Male 67, female 65, like that. Every country is having its own life expectancy. The average number of years lived in a country. Average number of years lived in a country. This is life expectancy. Now tell me, life expectancy will indicate quantity of living or quality of living. See the words properly. What it will indicate? Quantity of living or quality of living? Think and tell. Don't make basic mistake in this. Very easy question I am asking. Life expectancy will indicate quantity of living or quality of living? Quantity, yes, 67. It's just indicating the quantity of life, not related to quality. We don't know their suffering, how they suffer physically or mentally. Just we are calculating quantity. In the few next topics, I'll be discussing what is health adjusted life expectancy. That is totally different thing. Here, life expectancy of a country is good. Health status is in a positive way or a negative way? Think and tell. Life status or life expectancy is very high. Health status of a country is in a positive way or in a negative way? Think and tell. Very easy question I'm asking. Canada, Australia, Japan, they're living for a longer life. Good. That means health status is good or bad? Obviously good, it will go in a positive way. So it is one of the example of positive health indicator. Life expectancy is one of the example for positive health indicator. Very good. Write all these points. Positive health indicator, life expectancy is one of the examples for positive health indicator. So these are the things what they ask in the competitive exams for you, life expectancy related questions. Come to second thing, that is in the mortality, that is crude death rate. Crude death rate. Second example, write down this. Crude death rate means how many are dying in a population. Crude will indicate the word population. Risk of death in a given population. Write the definition. Risk of death in a given population. Risk of death in a given population. So it is the basic indicator of mortality. The formula is very simple. Deaths divided by mid-year population. What is MYP means? Mid-year population. If I want to calculate death rate of a given year, I'll be counting all the deaths which happen in that year divided by what was the population on July 1st. So mid-year population we calculate on which date if they ask? July 1st. That will be in the denominator. Later you calculate death rate of that year. Usually what we are having is the previous years only. So that is 6 per 1000. What is the recent crude death rate of our country? If they ask 6 per 1000 mid-year population. Now I want you to know, I will be asking two questions. What is the denominator of crude death rate? If I want to calculate for that year, what is the denominator of crude death rate? Good. Answer my question. What is the denominator of crude death rate? Everyone, very good. Mid-year population. Yes, the denominator is mid-year population. Very good. What is the recent infant mortality rate? What is the recent MMR? What is the recent crude death rate? I want you to type three numbers. What is the recent infant mortality rate? What is the recent MMR? And what is the recent crude death rate of our country? I want you to type three numbers now. We have to use this chat box in the maximum better possible way so that, yes, very good Abhinesh, very good beta. 28 per 1000 live births, sir, 97 per 1 lakh live births, 6 per 1000 mid-year population. The unit will change. Will you agree on this point? Yes or no? Obviously, the unit has to change. Depending on the indicator what we are using, the unit has to change. Crude death rate is 6 per 1000 mid-year population. So did you copy these points? Tell me yes or no. I'm asking like a school kid. Sir, did you copy all these points? Yes. 6 per 1000 mid-year population. Within crude death rate, continue. How to calculate growth rate? This is common sense. Population is increasing. Birth is more than death. So we are subtracting two things. Growth rate is crude birth rate minus crude death rate. Write down this formula. When you subtract two things, crude birth rate minus crude death rate. So when you subtract these two things, you are getting the answer. So growth rate is subtracting two things. Birth is addition to the population. Death is deletion to the population. Birth rate is addition, death rate is deletion. If birth rate is more than death rate, if birth rate is more than death rate, growth rate is positive or negative? Answer my simple question. Birth rate is more than death rate. Growth rate is positive or negative? Very simple question I am asking. Obviously, sir, it has to be positive. Birth is more. Birth is more. So it will be positive. For example, take this population. Very good. Example, take this population. You can type one letter. P means I will understand. Sir, it is positive. No need to type everything. You have to interact in letters or symbols. Like when some students are typing plus, plus, plus. Very good. You are getting used to the chat box also. This is the way we have to interact in a live interactive session. Yes. Calculate growth rate, express it in percentage. If this is the question I am asking. Calculate growth rate and express it in percentage. अभिनेश percentage में चाहिए बेटा. Good. 16 per 1000 हो गया ना. 100 में चाहिए ना. 20 per 1000, 4 per 1000. I want in 100 now. So 16 per 1000. Okay, agree. When you subtract per 100 चाहिए, it is 1.6%. Always growth rate is expressed in percentage. 1.6% is the answer. This is how you have to calculate growth rate of a country. There is one more formula what you should know. Highlight this formula first. Highlight one more formula, that is population doubling time. Given by Malthus. He was a demographer. He has done so many things for you, but you have to remember one thing. Malthusian model, 70 by growth rate. This is the formula. How many years it will take for the population to double? That has been given by the demographer, 70 by growth rate. So keep this formula. If I am asking this, growth rate of a country is 2%. Example I am telling, growth rate of a country is 2%. How much will be the population doubling time? See the words I am telling, directly I am telling, growth rate of a country is 2%. Growth rate of a country is 2%. 70 by 2. Yes, good. 70 by 2, 35 years. 35 years. 35 years. Yes, good. So it will take 35 years for the population to double. Then you can say plan out how many doctors I need, how many vehicles I need, how many super bikes I need. During that time, things will change. You can plan out. All this planning is very, very important in public health. Population doubling time is given by which? Population doubling time is given by which model, which formula? Answer my question. Population doubling time using growth rate. Using growth rate. Who devised that formula? Malthusian model, 70 by 2, 35 years. That is an example what I am telling. That is an example what I am telling. Yes, Malthusian model. Malthus has given this Malthusian model. How to estimate population doubling time. Crude death rate only we are discussing. Crude death rate is the simplest indicator of mortality. Can you tell the reason? Because the denominator is mid-year population. You are taking the whole population. It is age and sex specific. True or false? Think and tell everyone. Good in the chat box. Tell me, is it true or false? Crude death rate is age specific. True or false? Use this sense. Good. Tell me true or false. False, sir. Yes, good. It is false. I want that letter. Yeah, false. Good. Come on. Yes, it is not age or sex specific. It is not age or sex specific. It is the whole entity. Crude oil you are taking, you are not refining it. Yeah. Good. Here you are not refining it. It is the whole population what you are telling. That is why it is not specific. When I discuss the next indicator, that will be more specific, either age specific death rates or sex specific death rates. Age specific death rates or sex specific death rate. Got my point? Good. Crude death rate is age or sex specific. It is false statement. So these are the points what you should know. Very good. What is the first mortality indicator? I want everyone to type 2 mortality indicators discussed as of now. I want everyone to type 2 mortality indicators what we have discussed as of now. Yes, everyone. Those who are in the chat box. Good. One is life expectancy. Good. The second is crude death rate. Crude death rate. Now come to the third indicator, mortality number 3. Mortality indicator number 3 will be specific death rates. Specific death rates. What you should know properly is, one is age specific death rate, the other is sex specific death rate. You are refining the indicator now. Write down this. Age wise you are cutting into pieces. If I want to know age specific death rate of 5 to 10 years, write this formula. Good. Age specific death rate of 5 to 10 years. What is the thing what you are doing is, you are refining it. Very good. How many are dying in that age group? Denominator will be how many are there in that age group. This will indicate high risk age group for mortality. Tell me true or false. Think and tell. This will indicate high risk age group for mortality. This will indicate high risk age for mortality. Tell me true or false. I want to know high risk age groups for death. Whether it is 0 to 5, 5 to 10, just I want to know what indicator we are using. Yes, correct. It is true statement. High risk age group for mortality. We are using age specific death rate. We are using age specific death rate. When you are cutting the whole cake into so many pieces, every age group, how many are dying? That is what you are checking. When you are cutting the whole cake into so many, getting age specific death rate. If I add all these pieces, if I bring all the pieces together, what indicator I will get? Tell me. Good. I am cutting, cut. But if I am telling all the pieces together, if I am bringing all the pieces together in a rack, what indicator I am getting? This is my question. When you summate everything, summation of age specific death rates will give you crude death rate. Yes, sir. Common sense will give you crude death rates. Correct. Now what I want to do, I want to know which sex is having high risk of death, males or females. Like if I say males, yes, because of the risk factors. What indicator I am checking? Age specific death rate or sex specific death rate? What is your answer? Age specific death rate or sex specific death rate? Sex specific death rate. I am cutting my chocolate cake into two pieces, males and females. Most of the countries, males will be having more risk of death. That is common sense, because why should boys have all the fun? Like why should males have all the fun? Because of their fun risk factors, chance of death is more. Most of the countries, if the country females are dying more, that means the country status is not good, health status is not good, because maternal health is not given the importance. The only reason for females to die will be maternal health. That has to be given proper importance. Males, if they are dying, fine, because they are having risk factors. Females, yes, maternal health of a country should be very, very good. So got my point? High risk sex for mortality, it is sex specific death rate. High risk age for mortality, it is age specific death rate. Age specific death rate. So the third mortality indicator is specific death rates. But there is one more question which can be framed in the exam. Disease specific death rate. This is a bit difficult question if they frame in the exam. Disease specific death rate. For example of tuberculosis, I want to know. Write down the formula. Disease specific death rate of tuberculosis, I want to know. So what I'll be doing is, deaths due to TB in the numerator. Denominator I keep mid-year population. Remember this. So what is the denominator of disease specific death rates? Answer my question. What is the denominator of disease specific death rates? Numerator is common sense. Deaths due to TB. But denominator what we are keeping is mid-year population. So multiply with 1000. This is the formula for disease specific death rates. Disease specific death rates. Good. Denominator is mid-year population. Denominator is mid-year population. Correct. So now this is the question what the examiner is asking again and again. Don't make mistake in this question. Don't make mistake in this question. I am telling this, because here you are making a mistake. Got my point? I want everyone to type three things. So 1, 2, 3 mortality indicators what we have discussed. One is life expectancy. Give the number 1. Second is crude death rate. Third is specific death rates. Numbers are very, very important in life, I am telling. Not just here. Number 4 is, listen, answer my question. Specific death rates will indicate risk of death in different subgroups. True or false? Answer my question. Specific death rates like age and sex specific will indicate risk of death in different subgroups. True or false? Specific death rates will indicate risk of death in different subgroups. True or false? True statement. True statement, because it is age wise and sex wise risk what you are calculating. Highlight the words subgroups. Don't just write the notes. It's about highlighting the keywords. That is also very, very important. Did you highlight this keyword? Yes or no? I want everyone to give the response. Now let me see how many will type. Did you highlight the keywords? Very simple thing what I'm getting. Because live session means I want you to be with me. You're getting used to me. That is very, very important. Yes, correct. True statement, sir. Yes, means I'm highlighting the keywords. If you don't have a highlighter, beta, good. Abhinesh, very good, very, very good, impressed. If you don't have the highlighter, just underline this. Later when you revise, you can highlight that, nah? Because most of the students, they're not knowing how to do the notes initially. You have to write the notes, you have to highlight something, you have to answer the teacher. Slowly you'll get used to this. All these are habits what you will develop, nah? Good. So number 4 is proportional mortality rate. Proportional mortality rate. So if I want to know the contribution of a disease in the total mortality, I'll be going for proportional mortality rates like this in the pie chart. As you can see in the image, out of total deaths, which disease is contributing more? Answer my question. Out of the total diseases given in the pie chart, which disease is contributing more? Answer my question. Yes, it is the cancer, what you can see in the pie chart. If I want to know contribution of tuberculosis, good. If I want to know contribution of tuberculosis, what will be the numerator? What will be the denominator? Think and tell. I want everyone to type this. Good. I want to know the contribution of tuberculosis in terms of mortality. What is your numerator? What is your denominator? Answer my question. Everyone, good. Numerator is deaths due to TB. What will be the denominator? That is where you make mistake. Contribution I want to check. Na? So what will be the denominator? Everyone, yes, total deaths due to all the causes. In that, how much is your TB contributing? That will be in the numerator. Multiply with 100 means we express it in percentage. It is an example for proportion. Proportional mortality rate is not a rate, it is an example for proportion. So denominator is total deaths. Multiply with 100. We express it in proportion. So I'll give the example. First tell me, did you write the formula? Did you write the formula? Yes or no? Yes, denominator is total deaths. For example, I am telling out of 200 deaths, 20 died due to tuberculosis. Total number of deaths 200, 20 died due to tuberculosis. So what is the contribution of TB in percentage? Answer my question. Out of 200 deaths, 20 died due to tuberculosis. So what is the contribution of TB in terms of mortality percentage? I want 10%. Make one pie chart like this. Good. Example you take. Out of 200 deaths, 20 died due to tuberculosis. Correct. Make one pie chart like this. Everyone, good. Slowly everyone is coming into the system now. Everyone is answering, they're writing their notes. Everyone is playing a part. Like it's a team game what you're putting. Na? It's a teamwork which is very, very important. Not just one or two students dominating the chat box. I want everyone to get involved. I want some middle order batsmen also. I want some pinch hitters. I want some tail enders also. I want everyone. That is teamwork. What is very, very important for me. 10%. 10%. Yes, good. Remaining, if I am asking, what will be the remaining entity? If I am shading something 10% in that part, what will be the remaining entity? Answer my question. Everyone, good. It is deaths due to accidents. True or false? Think and tell. Deaths due to accidents. True or false? Very easy question I am asking. Deaths due to accidents. True or false? 90% yes. Deaths due to accidents. True or false? False statement. Sir, it is not due to accidents. It is due to other causes. Yes, write this. This will be one question in the exam. They will show a pie chart for you. Yes, they will show a pie chart for you. And then they will ask like what is the shaded portion? What is the unshaded portion? What is the advantage of knowing contribution of a disease? Like TB is contributing for 10%. TB is contributing for 10%. So what is the advantage of knowing contribution? What will be the advantage? What are the uses of proportional mortality rate? I want you to type something in the chat box. Whatever you want, you can type it. I will take the words from you. Let me see what is the basic level of assessment what you have. Good. Type anything, nothing to worry. Good. We all are together, like everyone is ours only. So there is nothing to worry. Type anything, whatever you want, you can type. So what are the uses of proportional mortality rate? Let me see the basic level. To understand the burden, very, 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 very good. Abhinesh, from which place, beta? Good. You're doing very good work. Like from the starting, you're like my power play. Virender Sewag. Huh? Good. What is the use of proportional mortality rate? Burden. Yes, burden. Correct. Burden for mortality or morbidity? Mortality. Mortality. Yes, correct. Mortality. So it can indicate burden of mortality. Means magnitude of mortality. That disease will contribute to how much? 10%. That idea you will get. Mortality indicator, very good. Yes, I agree. Then you will come to know where I have to invest my resources. Yes. What you are typing is split resources for monitoring. Agree. The disease which is contributing more, I have to contribute and I have to put some more input on those diseases. Like this will indicate most common cause of death in the population, true or false? Answer my question. This will indicate most common cause of death in the population, true or false? Very good, KD, contribution. I'm impressed with this word. I like this word, the word contribution. That is my favorite word actually. Yes, good. So now tell me. Good. This will indicate most common cause of death in the population, true or false? Very, 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 very simple question I'm asking. True, sir. Yes, good. Most common cause of death. Usually what will be the most common cause of death in the population? Most of the times nowadays, which will be the most common cause of death? In our country, I'm asking cardiovascular disease. Cardiovascular disease, heart attacks, heart attacks, heart attacks. You might have come across massive heart attack, sudden cardiac failure. So it is 40%. Most of them they die due to heart attacks, cardiovascular diseases. So these are the points on proportional mortality rate. So we have finished 4 mortality indicators: life expectancy, crude death rate, specific death rate, and proportional mortality rate. 1, 2, 3, and 4. Total 4 mortality indicators we have finished. I want you to know one more mortality indicator which can indicate how dangerous is the disease. The severity of disease I want to know. Virulence of a disease. Yes. Yes. Now tell me the answer. I want to know the severity of a disease. I want to know the virulence of an illness. What indicator is used? Like if I am telling 100 cases, 100 will die. What is that indicator? 100 cases, 100 will die. What is that indicator used to indicate virulence of a disease? Answer my question. It is case fatality rate. Case fatality rate. CFR, not crude, it is case. Very good, Abhinesh. Case fatality rate. For example, I want to know case fatality rate of Japanese encephalitis. I want to know case fatality rate of Japanese encephalitis. What is the denominator? What is the numerator? Type it. What is the denominator? What is the numerator? Yes, everyone. Denominator will be case. See the words there only. Denominator will be cases, numerator will be death. How many will die? How many will die in that population or in that disease? Yes, denominator will be cases. For example, yes, case fatality. Out of 200 cases, 60 will die. Listen to my words properly. Out of 200 cases, 60 will die. So what is case fatality rate of Japanese encephalitis? Example I am telling. Out of 200 cases, 60 will die. Answer my question. Out of 200 cases, 60 will die. What is case fatality rate of Japanese encephalitis? Everyone, good. कितना हो गया बेटा? 200 में 60 ना? कितना percent? 30%. Make one pie chart. Make one pie chart. 30% is case fatality rate of this disease. Everyone, yes, good. 30% is case fatality rate of this disease. So if 30% is case fatality rate, how many will survive? What is the survival rate of this illness? Answer my question. What is the survival rate of this illness? How much? 70%. So both will go opposite. If it is 30, the other has to be 70. If it is 20, the other has to be 80. Like that it will go 30, 70, 60, 40. Yes, good. 70% will be the survival rate. Both of the things they complement each other. Means in total it is 100%. Got my point? Now tell what is the use of knowing case fatality rates? What is the use of knowing case fatality rate of a disease? Answer my question. What are the words which I used for case fatality rate? Answer my question, everyone. Good. What are the words which I used for case fatality rate? Already I have given the words for you. I want you to know the uses of case fatality rate. Yes, severity of a disease, virulence of a disease, killing power of a disease. All these words will go in favor of case fatality rates. Yes, good. Case fatality rates. Underline this word. Severity, virulence, killing power. Severity, virulence, killing power of a disease. Very good. Those who are typing virulence, very, very good. I want the keywords. When you are typing the keyword what I want, then you will get that symbol. What I am putting that heart into you. Na? Good. Very, very good, KD. So, virulence, severity and killing power of a disease. Very, very, very good. So, total 5 mortality indicators I have discussed in my hand. Repeat. 1, 2, 3, 4, 5. Life expectancy, crude. Then you make it specific age and sex. Then you go for the contribution, proportional mortality rate. At last we calculate case fatality rate of the illness. So, everyone, is it fine as of now? Did you write all the points? Here, did you note down all the points? What has been discussed in the first subheading and the second subheading? I want your approval also. Good. Once you're in the chat box, it's like Viva session. You will never forget in your life because the teacher is asking the question and you're answering something. If you're making it wrong, good. You will not repeat that mistake again. That is why we are correcting the mistakes also. Good. Good. Very good. Come to the next thing. What is the use of 5-year survival rate? This is separate indicator. What is the use of 5-year survival rate? Where you come across this word? Can you tell some points? Good. Where you come across this word? Cancer. Yes. Hodgkin's lymphoma. Non-Hodgkin's lymphoma. Agreed. Yes. What is the advantage of knowing 5-year survival rate in cancer? Stage 1, stage 2. What you can tell? What you can tell for the patient? Stage 1 cancer, stage 2 cancer. Yes, very good. Prognosis. Bracket you write. Usually used in cancer now. 5-year survival rate. You can compare the prognostic part. If they mention prognosis, you have to mention it as 5-year survival rates only. The indicator used to express prognosis of cancer. It is 5-year survival rates. Also, if I am asking this question, 5-year survival rates can help in comparing which treatment is good, comparing effectiveness of treatment, comparing standards of therapy, true or false. Think and tell. Think and tell. I am telling the statement for you. These true false questions are very, very important to know. It will help to reach you and at the same time it will help to assess your knowledge also, whether you are getting what I am asking or not. True statement. It will help to tell how good is the treatment, standards of treatment. Yes, agreed on this. Because I can compare radiotherapy versus chemotherapy, for example. Hodgkin's lymphoma, I am telling whether radio is good or chemo is good. Radiotherapy survival rate is 50%. Chemotherapy survival rate is 20%. Like this, I can compare how many will survive after 5 years. Example I am telling. So now tell me which treatment is giving a better survival rate. This is my question. Which treatment is giving a better survival rate? Radiotherapy versus chemotherapy I am telling now. So which treatment is giving a better survival rate? Radiotherapy. Yes, very good. 50%. So that is giving a better survival rate comparatively. So what indicator is used to compare standards of treatment? Answer my question. What indicator is used to compare standards of treatment? Answer my question. Very good. What indicator is used to compare standards of treatment? 5-year survival rates. 5-year survival rates. Yes, very good. Now come to the next indicator. Morbidity indicators. There are two things in morbidity indicators, right? One is incidence, two is prevalence. I'll be discussing morbidity indicators in detail now. So write down this. So one is incidence, the second one is prevalence. One is incidence, the second one is prevalence. So what is the definition of incidence? Thoda sa we have discussed incidence and prevalence, na? Already we have discussed the basic part of incidence and prevalence. So where you come across this word incidence? Answer my question. What is incidence? New cases or old cases? New cases. Yes, write this point first. New cases with respect to time. With respect to time. How many will develop disease in the future? New cases. So once new cases are developing, risk of developing disease is more or less. Indirectly I am asking whether incidence will indicate risk of developing disease. True or false? Think and tell whether incidence will indicate risk of developing disease or not. New cases are getting in the system community. Yes, good. It will also indicate risk of developing disease. Very, very good. Risk of developing disease. Highlight the keywords. Highlight all the keywords. New cases, time, risk. Highlight all the keywords. One is new case, second is risk, the third is time. New cases, risk and time. So what will be the formula? Can you tell? See the formula, it is written there. Can you tell what is the formula for incidence? You can see whatever is there in the image. That is the formula for incidence. So very simple formula we will get for incidence. So what is the formula for incidence? New cases by population at risk. New cases divided by population at risk. That is a formula for incidence. Good. So multiplier can be 100,000 depending on the question. If they ask calculate per 100, you multiply with 100. If they ask calculate per 1000, you multiply with 1000. So now my question is, you are taking population at risk. After certain time you are doing follow up in the study and new cases will develop. So incidence is calculated from follow up studies. True or false? Answer my question. Incidence is calculated from follow up studies. True or false? See the words what I am using. Incidence is calculated from follow up studies. True or false? True statement. We have to invest time in the study because we are taking population at risk. In the future, how many new cases will develop? So we need to invest time in the study. What is that study where follow-up is being done? Where you get incidence? You'll be knowing some basic words. I'll be asking the question. That study is called as cohort study. Very good. Incidence is calculated from follow-up studies. That is cohort study. Write this word. Incidence is calculated from cohort study. Cohort study because we do follow up. Again, I will teach study designs in detail later, but you should know this word. Cohort study. Those who are new to PSM, Very few students, but many of them, they know this. Cohort studies will give incidence for you, means how many will develop disease in the future. For example, take this question. Take this question. I'll give one mathematical solution to be done. Very easy question I'm giving. Population is 5,000. Copy this question. 500 are having myopia on January 1st. Population is 5,000. 500 are having myopia on January 1st. During 1 year, 90 new cases developed. During 1 year, 90 new cases developed. Calculate incidence per 1000. Calculate incidence per 1000. Go step by step. Highlight this number 500. This is very important number for me. Using this number, everything will open up now. Using this number, the whole thing will open up now. Abhinesh, do it properly. Denominator is population at risk. Think and do it. 18 is not the answer. Good. But I like your participation. That is very, very important. Starting से लेके अभी तक, I want you to maintain the same level of energy. I need someone to talk to. Telegram group is there. That is the way we are interacting with you. Good. Yes, tell me. Do it step by step. Very good. Good. Go do step by step. Nothing will happen. First, if 500 are already having disease, they are not at risk. Subtract them. Subtract this number. Now you get everything. This is the first step what you have to do. Population at risk. Population at risk. That is the first thing what you have to do. But my point, first you have to calculate population at risk. Out of 4,500, 90 new cases will develop. Very good. Now you are getting the answer. Out of 4,500, 90 new cases will develop. For 4,590, for 1000, how much? That is the question. For 4,590, for 1000, how much you are getting? So what is the answer, Sam? Very good. 20 per 1000. That is the answer. So what mistake you did, Avinash, initially, where you got the answer as 18? That mistake you have done now, but that mistake will not be repeated in the exam. That is the only way of correcting your mistake. You are having someone to correct that mistake also. That is the advantage of live session. Interactive live batch का मतलब वही advantage है. You'll be having all the necessary things where you are not making that mistake. Yes. What is the first step? Is population at risk. First step is population at risk. 4,500 in that 20. Yes, 20 per 1000 is the answer. So everyone got this? Did you copy all these points? Tell me yes or no. Did you got this point? Very easy question. I'll put one more question now. First question to calculate incidence. I'll give one more question to calculate incidence now. I'm asking the response of those students who are online in the Telegram group. Yes or no? Did you copy this point? What has to be done? What is the first step? What is the next step? How to calculate per 1000 if they ask multiply with 1000. Per 100 if they ask multiply with 100. Very good. Take next question. 100 painters are followed up for 2 years. Good. 100 painters are followed up for 2 years. 20 new cases of dermatitis developed. 20 new cases of dermatitis developed. Calculate incidence per 100% years. Copy down the question first. Aram se copy it. Then I'll tell how to do this question. What is the difference between the previous question and this question? 100 painters are followed up for 2 years. Twenty new cases of dermatitis developed. 20 new cases of dermatitis developed. So they're asking you to calculate incidence per 100 person years. Very good. Yes, Abhinesh. 10 is the answer. Very, very good. So listen now. What you are doing is incidence density in the question. What you are doing is incidence density. Denominator is population, what you have, into time. Denominator is population into time. Numerator is new cases. Numerator is new cases. Then you have to multiply with 100. Then you have to multiply with 100 because they are asking 100 person years. Now do this question. Population means how many painters are there? 100. How many years of follow-up? That is important. Now 2 years of follow-up. How many new cases developed? 20. How many new cases developed? 20. Then when you calculate, cancel 20 by 2. 10 per 100 person years. Got my point? 2 years of follow-up is also given importance here. Yes. Did you get what I did in the calculation? Did you got my point? Tell me yes or no. Very easy calculation. The only thing what I have to do is give importance for follow-up duration also. Initially 100 workers, 2 years of follow-up. Yes, incidence density is extra edge question. When the paper is difficult, they will ask incidence density for you. Got my point? Yes. 10 per 100 person years. 10 per 100 person years. So did you got this question? Like, did you get my point? You can do indirectly what Abhinesh did initially, na? Without touching pen paper. 100 into 2 he did, I think. 200 person years. Risk is 20. This is what you did initially, na? Without formula you can do this question. 100 2s are 200. For 200 person years, risk is 20. Question is for 100 person years. This is direct answer actually. Very easy way to calculate. Instead of doing this and doing the same thing in the formula mode, you can directly do this. 200 person years, risk is 20. For 100 person years, what is the risk? What is your answer? I want everyone to type it now. At least you are typing it now. 100 2s are 200. 200 के लिए 20. For 100 के लिए how much? So what is your answer? So answer is 10. Answer is 10. Correct answer. This is the answer. This is the way to calculate incidence density. So what are you discussing? Like what are we discussing now? It is the incidence part what we are discussing now. Since the study is having follow-up, what are the uses of incidence? Next line. What are the uses of incidence? When you are doing follow-up, what you can get? Can anyone tell the answers to me? Can anyone tell some keywords to me in the chat box? Good. If I am studying incidence, what I can infer? Yes. What I can get out of incidence? That is my question. Very simple question I am asking. Yes, correct. Good. I am going in a forward direction. Now, exposures to outcome. That is what I am studying. Starting from smoking towards cancer, I can study risk of a disease. Used to calculate risk of developing disease. Yes, agree. That is also agreed. I will teach that later. Yes. First point. Second point, nothing but causality or etiology what you are studying. Will you agree on this point? Yes or no? Because the study is having follow-up, na? It can be used to study the etiological hypothesis, true or false. It can be used to study the etiological hypothesis, true or false. Answer my question. It can be used to study the etiological hypothesis, true or false, because you are going from exposure and landing in outcome, risk factor to disease. Yes, correct. This sequence is very, very important for me. This sequence is called as, anyone in the class, if you can tell the word smoking to lung cancer, exposure to outcome, what is that sequence what you are studying called as? Not the study I am asking, I am telling what is that sequence called as. Study, you know, cohort study. But I want that word, which is my favorite word. That sequence is called as Abhinesh, yes, beta, good prospective pattern. Or coach, I'll give the alphabet for you. T. T for what association? KD knows everything actually. Good. This is temporal association. This is temporal association. Temporality, what you are studying. The most important criteria to prove etiology is temporal association. Write this point. Most important criteria in order to prove etiology is temporal association. Cohort study can be used for etiological purpose. True or false? Think and tell. Cohort study can be used for etiological purpose. True or false? Think and tell. Very good. Cohort studies can be used to study etiological hypothesis. True or false? Yes, if it is true, what is the reason? I want one more T now. If it is true, what is the reason? I'm asking. What association is proved in a cohort study? What association is proved in a cohort study? What association you can prove? If I start drinking alcohol now, after 10 years, I may develop liver cancer. Yes, that is called as temporality. Cause first, effect next. Exposure first, outcome next. That sequence is called as temporality. Yes, good. Now come to prevalence. Now what is prevalence? New cases or existing cases? Already written, same thing I am asking. We have finished incidence and we are discussing prevalence. Now one more morbidity indicator. Tell me, you can see here, you can check how many are having disease in the class now. How many are having disease in the class? Existing cases what we have at one point of time. Existing cases at one point of time. Existing cases at one point of time. This is prevalent in our country. Prevalence means present tense. Incidence means what will develop in the future. Prevalence means present tense. Existing cases at one point of time. Very good. Existing cases at one point of time. Like for example, 200 students are there. 20 are having refractive errors. What is the prevalence in the class? Answer my question. 200 students are there. 20 are having refractive errors. 20 are having refractive errors. So what is the prevalence of disease in the class? Answer my question. Out of 200 students, 20 are having refractive errors. So what is the prevalence of disease in the class? What is the prevalence of refractive errors in the class? Make one pie chart like this. 10% will be the answer. So it is pie charts what you are using to represent prevalence. Keep this in mind. It is pie charts what you will be using to represent prevalence or proportion. Pie charts, good. What study is this? Follow-up is done, yes or no? Think and tell. Very easy question I am asking. Follow-up is done, true or false? Yes or no? Follow-up is being done. Tell me yes or no. Yes, good. No, sir, there is no follow-up because you are going to the class and checking how many are having disease. Follow-up is not done. What study is this? Cross-sectional study. It is done at one point of time. There is no follow-up. It is done at one point of time. There is no follow-up. It will tell how many are having disease, not that how they developed disease. It will indicate burden of disease, not risk of developing disease. If I am asking this question, cross-sectional study can be used for etiological purpose, true or false? Think and tell. Very good. The discussion what we are doing is next level PSM, what we are teaching now. Every MCQ is being covered. You'll understand it properly now. Cross-sectional study can be used for etiological purpose. True or false? Tell me yes or no. False. What is the reason? What is missing in cross-sectional study? Good. Tell the answer now. Have that confidence. Good. Tell the answer. What is missing in cross-sectional study? Now slowly you will feel good that you are knowing something in the subject. That feel good factor is also very, very, very important. I am telling. That positiveness what will accumulate daily. That positive energy. Follow-up is missing, sir. Yes, very good. What association is missing, Abhinesh? Good. What association is missing? Good. Temporal association is absent. That is your answer. You have to go to the next level. Where a level you have to reach, that is what I am telling. Temporal association is absent. Temporal association is absent. Good. Number 1, incidence. Number 2, prevalence. Prevalence of a disease depends on 2 factors. Highlight this equation. PID. Incidence and duration of disease. Prevalence depends on 2 things. Incidence and duration of disease. Correct. Write this. Means new cases are adding on. For example, like this. New cases are adding on. If new cases are getting added, what happens to prevalence? Increase or decrease? Tell me. Easy question I am asking. If new cases are adding on, prevalence will increase or decrease? No need to write this image in the notes like bathtub, bathroom, toilet and all. Those will make you to write what you have to write. Now tell me if incidence is increasing, prevalence will increase or decrease? This is my question. New cases are adding on to the system. Good, prevalence will increase, but there is a way how prevalence will decrease. Tell me 2 things which will reduce prevalence. Answer my question. Outlet I am asking. First question was on inlet. The second question what I am asking is on the outlet of this pool. Water can come in, water can go out. Now I am asking the outlet. I'm asking the outlet now. Good. Very, very, very good. 2 things. Recovery and death. Cure and death. Cure and death. Write this. This is what I showed there in the image. Incidence, prevalence in the center, pool, cross-sectional study you do. But there are 2 things which will reduce prevalence. Cure and death. Natural phenomenon. Some will get cure, some will die. Those 2 things will reduce prevalence. 2 things which will reduce prevalence. So inlet is new case. Outlet will be something which will reduce the existing cases. Either they will get cure or they will die. That means prevalence is more for acute illness or chronic illness. Same image I am asking in a different way for you. Prevalence is more for acute illness or chronic illness. Answer my question. Very good. Prevalence is more for acute illness or chronic illness. That means there is one thing called as duration of disease, which will influence prevalence. Either it is of long duration or short duration. Prevalence is more for chronic illness. Correct. Give some examples. One side you make acute duration or acute illness, chronic illness. Make this table. Short duration, either it is acute or chronic. Short duration, acute illness, highly fatal, easily curable. I want one example each for acute illness. Yes, highly fatal, easily curable. I am asking highly fatal, easily curable. Highly fatal, easily curable. I am asking these words. Highly fatal, rabies, easily curable, coryza. Highly fatal, rabies, easily curable, coryza, common cold. Very difficult to detect on cross section. Today if I ask how many of you have common cold? So today I don't have. I had 1 week before. Yes, the disease is self-limiting. Cross-sectional studies cannot identify these acute illness usually. So acute illness will be having more prevalence or less prevalence? Answer my question. Very, very good. Acute illness will be having more prevalence or less prevalence? Answer my question. Good. Less prevalence. It will be less. It will be less. Good. Come to the other side. Chronic disease, long-standing illness, no death, no cure. Lifelong treatment you're taking, anti-diabetics, anti-hypertensive. Write the examples. Diabetes, hypertension, all this will come under chronic illness. All this will come under chronic illness. Chronic illness will be having more prevalence. Will you agree on this point? Yes or no? Chronic illness will be having more prevalence. Tell me yes or no. Chronic illness will be having more prevalence. Tell me yes or no. See the words what I am telling. Good. More prevalence. Chronic illness will be having more prevalence. Yes, correct. Write this. Now answer my next question. Common cold is having high incidence but less prevalence. What is the reason? Within a year, I will develop 3-4 times. Within a year, common cold I will develop 3-4 times. But prevalence is very, very less. What can be the reason? What is your answer? Because you know the equation, I am playing with the equation of P is equal to I into D. Same question I am asking. If I is more, within 1 year, I will develop 3-4 times. Within 1 year, I will develop 3-4 times common cold. But prevalence is very less. Prevalence is very less. What is the reason? What is less in common cold? Acute illness, duration is less. That is the reason why you will get less prevalence. Less prevalence. That means when you do a cross-sectional study, answer my first question. Cross-sectional studies are preferred for acute illness or chronic illness. Now think and tell. Cross-sectional studies are preferred for acute illness or chronic illness. Think and tell now. Cross-sectional studies are preferred for acute illness or chronic illness. Chronic diseases, acute illness, it is not easily identified. We do it and we prefer for chronic diseases. We prefer it for chronic diseases. Yes, good. Write this word. We prefer for chronic diseases. Like burden, if I want to check. So it is not more about the risk. What we are checking is the burden. What we are checking is the burden. Now answer my question. Next question. See the words. Next question. Chronic illness like diabetes will be having more prevalence. What will be the reason? Same. Indirectly I am asking in a different way. Tell me. Chronic illness like diabetes will be having, yes, good, more prevalence. What will be the reason? High incidence, long duration. What is your answer? High incidence, long duration. What is your answer? This slide what you are commenting is mainly on the duration part. This slide what you are commenting is mainly on the duration part. Now answer my question. Yes, correct. Chronic illness like diabetes will be having more prevalence. So what can be the reason? Long duration is the answer. Yes, sir. Long duration. Long duration will be the answer. It's about the duration what you are commenting. So statement 1, 2, 3. Very, very important. You're answering it correct. Good. Copy the notes and highlight the keywords. And once you highlight all these words, did you copy the note proper? Then let me know. I'll go to the next slide. I'll be discussing what will happen if a new intervention comes. Something like a new vaccine will come. A new cure for cancer has come. So what will happen to incidence? What will happen to prevalence? Good. Yes, correct. Very, very good. Now tell me the answers for the first thing and the next thing. Once you note all these points which has been discussed, very important PYQs. Same to same question will come and has come in the past exams also. Now tell what is happening in this situation first. A new effective treatment for cancer, like a surgical intervention you have invented now, which will remove the cancer. Effective means cure. Cancer is non-communicable disease. Incidence will change, true or false? Think and tell. Incidence will change, true or false? See the words properly. Something which is curing, like surgical intervention you are putting, which is curing a disease which is existing. Cancer, non-communicable disease. Incidence will change, true or false? Good. False statement. Yes, sir. Incidence, no change. It is not preventing anything. Prevalence will decrease. Incidence will not change, but prevalence will decrease. Good. Incidence will not change. You are not preventing any new cases. No, you are not preventing anything. You are not preventing anything. So new cases will not change. If you prevent something, only new cases will change. You are not preventing anything. The only thing which will change is the prevalence. Existing cases will decrease. Incidence, no change. Okay, good. First tell me yes or no. Will you agree on this point, yes or no? So that I will give one more situation now. First situation, what you are doing is you are curing a disease. You are curing a disease. You should know the definition of incidence and prevalence and what we have discussed. Then these situations will become very easy. First tell me, did you got my point, yes or no? So that I will go to the next situation. Do you get my point, yes or no? Good. Now come to the next situation. Okay, good. Soham, you did some mistake in that question, no? Beta, good. Yes. Now come to this. A new treatment for cancer, prolonging the survival but no cure. Like something like chemotherapy you are putting. Chemotherapy, example I am telling. You are just making the patient to live for a longer duration. Now I want you to answer this question. What will happen to incidence? See the word, it is cancer. See the words I am highlighting, prolonging the survival. Just I am telling this word, prolonging the survival. Now tell what will happen to incidence, what will happen to prevalence. Tell me, good. You are prolonging the survival, na? That is the word which I want. Duration is increased. Correct. Yes. Prevalence will increase. Okay, agree. Last year prevalence 10%, this year prevalence 15% because of the patient is living and you are counting the patient. Incidence no change. Yes. Incidence will be the same. Good. Abhijit. Very good. Correct. Yes. Prevalence will increase. Last year, this year prevalence can increase. This is very important question. Note down this question. Note down this question. Prevalence will increase, incidence no change. You will come to know the importance of chat box, the interaction with the teacher once you are revising the notes within very short duration of time. That is the difference between one more student and you. If you are using the chat box in a proper way or answering the question, there is no need to revise only. Everything is like we are revising everything within the class only. One more, just turn the page like robot. Everything will go into your head. I'll ask third situation now. We'll ask third situation now. 1, 2. Come to the third. If I have a new treatment for a communicable disease, think and tell. Very good. If I have a new intervention for a communicable disease, what will happen to incidence? What will happen to prevalence? Think and tell. Good. Very good. A new effective treatment for a communicable disease. Like if I am having a TB patient now. I'm having a TB patient now. Both will reduce. You are giving treatment for a patient, that means patient transmission is also reduced. Communicable disease transmission is coming down. So obviously I will decrease. If I is decreasing, P will also decrease. Both will come down. Tell me yes or no. Yes, good. Both will decrease. Both will decrease. Yes or no? Answer is yes, sir. Obviously the transmission is reduced. New cases, the risk will come down, and at the same time B will also decrease. This is one question. Fourth question is, a new vaccine or a new prophylactic intervention we have invented. A new prophylactic intervention we have invented. Something like a new vaccine or a new chemoprophylactic regimen in the contacts what you are putting. Easy question. The word is prophylaxis, means prevention. What will come down initially? Incidence will decrease because you are preventing new cases. Incidence will decrease. You are preventing new cases. If new cases are coming down, you know the equation. P is equal to I into D. If I is decreasing, P will also decrease. So both will decrease, obviously. So new cases will also come down. Obviously it has to come down. That is the role of vaccine. That is the role of chemoprophylactic regimen, something you are preventive, that is public health. If I is coming down, P will also decrease. P will also decrease. Both should decrease. Will you agree on this? Tell me yes or no. Let me see how many will type in the chat box now. Tell me yes or no. Interactive session live batch will be very interesting, very interactive if the students interact in the chat box. That is the main advantage of this. That is where 50% of the advantage lies, because you are speaking to the teacher, you are asking something, you are telling something, that is what you are sharing, everything. Good. Both will decrease. Both will decrease. Good. If I want to check the impact of a new preventive intervention, for example, I'm having a new vaccine. I want to check the impact of a new preventive intervention. Which is the better indicator? Think and tell. Incidence or prevalence? Impact of a new preventive intervention. Impact of a new preventive intervention. Which is a better indicator? Incidence or prevalence? Again, think and tell. Impact I want to check of a new intervention which is preventive. Better indicator is always to check for incidence to come down initially. So incidence will be the impact indicator. I will agree on this. Yes. Incidence will be the impact indicator. I don't want to wait till prevalence to come down. Initially, the risk of developing disease has to come down in the system. That is the role of chemoprophylaxis. That is the role of vaccine what I am putting. Prevalence will take some time. That depends on the duration of disease also. Got my point? Yes. Impact of a new preventive intervention is assessed by using incidence. Assessed by using incidence. Give numbers. I have given all the situations now. P is equal to I into D. A new effective treatment for cancer. First question. A new treatment for cancer prolonging the survival. Second question. A new effective treatment for communicable disease. Third question. A new preventive, a new prophylactic intervention. Fourth question. So before going to the next subheading, did you finish writing all the points on prevalence, incidence and duration? Did you write all the points related to P is equal to I into D? What is there in the center? What is going out? Did you copy all the points related to these three words? P, I, D. Prevalence, incidence, duration. Tell me yes or no. The pool, water, something is coming in, something is going out. Yes, good. So the red wine in the hand, cheers, like so. We have finished the equation part also. P is equal to I into D. P is equal to I into D. Now come to the last two subheadings in this chapter. How to calculate the index, what is the importance? There are three index you should know: HDI, PQLI and MPI. Index is the combination of indicators. Combination of indicators. Combination of indicators. Human Development Index, Physical Quality of Life Index, Multidimensional Poverty Index. So HDI, PQLI, MDPI. I want everyone to cut copy the same thing what I am typing there in the chat box. HDI, PQLI and MDPI. There is a way also to learn in the live batch. You have to follow the teacher and the way he is teaching. The same way, if you are following at last, once you finish the subject, you will get that confidence. Once you revise, you will have that conciseness. Slowly, that positiveness in that subject will improve. Good. HDI, PQLI and MDPI. Human Development Index, Physical Quality of Life Index and Multidimensional Poverty Index. HDI will tell how good is the country. It is used to check standard of living between the countries. PQLI is used to check quality of life, subjective well-being, quality of life. Poverty index will help to compare poverty status in the country with one more country. Now tell me, which index is used to compare standard of living? Answer my question. Which index is used to compare standard of living between the countries? Answer my question number 1. Which index is used to compare standard of living between the countries? Yes, correct. HDI, standard of living. So we'll discuss one by one. What indicators are used? What are the dimensions? What indicators are used and what are the dimensions? What is there in Human Development Index? What is there in PQLI? And what is there in MDPI? Poverty status. Number 1 is HDI. How good is the country? Standard of living I want to check between India, Nepal, India, Canada, India, Sri Lanka, like that. For example, I am telling. Human Development Index, HDI. Human Development Index. So what are the dimensions and what are the indicators? Now tell me, if I am telling how good is the country, what are the things which are important for us? Just type whatever you want. Type something. Standard of living means what is more important for a life, I am telling. Good. Tell me. Yes. I am telling, for example, India is better than Sri Lanka. For example, I am telling Nepal. So how good it is? Life expectancy. Okay, understood. You have to live. But there is a sequence. First and foremost, everything starts with knowledge. That is very important for us. Education. We have to gain some knowledge. Then, yes, because of knowledge, money, income, economic status. Income. Once you have knowledge, income and longevity. If these three dimensions are covered in a proper way, country is well developed, the living status will be better. So what are the dimensions and what are the indicators used? Tell me the mnemonic. Knowledge, income, longevity. There are three dimensions in total. There are three dimensions. Within knowledge, what are the indicators used? Mean years of schooling and expected years of schooling. We don't use literacy rate now. This is the old thing. Literacy rate is not considered now. Keep this in mind. Got my point, Abhinesh? Literacy rate is not considered. We are counting the average years of schooling, at the same time expected years of schooling in that country based on the dropout rate. If the dropout rate is more, expected years will come down. Dropout rate is more because the living status is not good. They want their child to work and earn something for their family. That is why dropout rate is more. Expected years of schooling will be less. So these are the two indicators in knowledge part. Income, we are checking GNI. What is the full form of GNI? Gross national income. We don't just check GDP. GDP is the initial thing. Gross domestic product. What we produce in our country, that is GDP. Along with that, what help we get from other countries, that is also added. That extra help what you are getting from other country will become gross national income. So what is the indicator under income in HDI? What is your answer? Type it. What is the indicator used under income in Human Development Index? This is the question. I want your answer in the chat box. Yes, good. I'm also typing the same thing. Good. What is your indicator under the dimension of income under Human Development Index? It is per capita GNI. Good. Life expectancy we count from birth. Life expectancy we count from birth. So from birth we are checking their longevity. Overall, when you check the dimensions, you get the index, that is Human Development Index. Every dimension is given equal 1/3 importance. Remember this. When you calculate the average, every dimension is given equal 1/3 importance. Write this point. Knowledge component is given 2/3 importance. True or false? Answer my question. Knowledge component is given 2/3 importance. True or false? Knowledge component is given 2/3 importance. True or false? False statement. Everything is given equal 1/3 importance. When you calculate HDI, you are taking the average. Geometric mean, what you are counting? Geometric mean of all the three indices. HDI is arithmetic mean or geometric mean? That is my next question. HDI is arithmetic mean or geometric mean? Answer my question. Human Development Index is arithmetic mean or geometric mean? Every dimension is given equal 1/3, so obviously we have to take the cube root. It is not arithmetic mean, it is geometric mean. Keep this in mind. Value ranges from 0 to 1. And India is having this value of 0.633, rank 132 now. They won't ask the exact value of HDI, but still if you know, it is good. Ranking is given for the countries. So India is ranking 132 in the list of total around 189 countries. India is ranking 132. So what might be the reason? There are so many reasons. Knowledge component, it is good, but income they are not showing initially. For longevity, there will be some reduction in the longevity because of some COVID pandemics. So the value has reduced a bit. Rank 132. Which country is rank 1 in Human Development Index? Any guess? Which country is rank 1 now? This is my question. According to Human Development Index, there are different index I'll be teaching later. PQLI, MDPI, but according to HDI I am asking. Human Development Index, which country rank 1? Or kuch? Germany? No? Then make a guess. Around Germany only. You go to Germany, the flight ticket from there to that country is very less, around 2,000 or 3,000 rupees, I think, in rupees, maybe. Norway was the old thing. What is the newer thing now? Rank 1 now. Which country is rank 1? Norway was the old. Now it is Switzerland. Now it is Switzerland. Second is Norway. So they keep on fluctuating between Norway, Switzerland, there only. Small countries, very cute countries. So the index also fluctuates in between these two countries only. So rank 1 is Switzerland. Rank 1 is Switzerland. Got my point? What is used to compare quality of life? This is my next question. What is used to compare quality of life? Answer my next question. Good. What index is used to compare quality of life? where income is not considered. This is the word what I am telling. Where income is not considered. PQLI, income is not included in this. Write this point. Income is not considered. That component which is missing, very, very important. We are using infant mortality rate, not income directly. Literacy rate and life expectancy from age 1. Because IMR is given separate importance, na? So life expectancy from age 1 we are counting. So ILL, L. Human Development Index is kill, but here it is ill. Infant mortality rate, literacy rate, and life expectancy from age 1. So what is not considered, I want everyone to write this again in the chat box also, because here you make some blunders in the exam. So I don't want that blunders to be committed again, which is missing in PQLI. This is my question. Which is absent in physical quality of life index. Answer my question. Which is missing in PQLI. Income. Income is not considered. Income is not considered. When you calculate the index, the average what you will be taking PQLI, the value ranges from 0 to 100. So the value of India is 70. The value of India is 70. Good. So listen to the question. PQLI ranges from 0 to 1. True or false? Answer my question. PQLI, Physical Quality of Life Index, ranges from 0 to 1. True or false? Physical Quality of Life Index ranges from 0 to 1. True or false? False statement. It is not 0 to 1. It is 0 to 100. HDI ranges from 0 to 1. So tell me the mnemonic for HDI, kill, and for PQLI it is ill. I want everyone to type the 3 letters. Kill, ill. Knowledge, income, longevity. HDI. Infant mortality rate, literacy rate, life expectancy at age 1. PQLI. PQLI. So the next thing what I have to discuss is poverty part. The next thing what I have to discuss is poverty. Multi-dimensional poverty index. Human Development Index for standard of living. For poverty we have multi-dimensional poverty index. Initially human poverty index was used, but now we don't have human poverty index. We are having multi-dimensional poverty index. Highlight the dimensions used. Health, education, living standards. Health, education, living standards. Within health, these two indicators are used. Child mortality. Within education, school attendance rate is also considered. If you are asking with proxy, without proxy, that is not mentioned in the guidelines, so no need to worry about that. Just write school attendance. Cooking fuel, water, toilet, around the kitchen. Fuel, water, toilet, electricity, floor and assets. Total 6 indicators here. 2 indicators, 2 and 6. Total 3 dimensions, 10 indicators. Write my words properly. 3 dimensions, 10 indicators. Multi-dimensional poverty index. What was used before for poverty? Human poverty index. Now what we are using? Multi-dimensional poverty index. How many dimensions? How many indicators? I want everyone to type the numbers because this is a previous year question repeatedly asked. How many dimensions? How many indicators? Answer my question again. Good. How many indicators? How many dimensions? 3 dimensions, sir. Yes, good. How many indicators? 10. When you calculate the average, every dimension is given equal 1/3 importance. Every dimension is given equal 1/3 importance. Good. Every dimension is given equal 1/3 importance. Now think and tell. Child mortality is given 1/3 importance. True or false? Think and tell. Don't make mistake. I'm asking basic level of mathematics from you. Child mortality is given 1/3 importance. True or false? Think and tell. Very good. Yes, correct. Binay Shubham, very good. Now tell my answer. If health is given 1/3, the other two indicators has to be given equally, divided by like to 1/6, 1/6. Like this. Okay, sir. Yes, correct. Very good. The same here also 1/6, 1/6. Here it is 1/18th of importance is given. 1/18th of importance is given. When you calculate MDPI, it also ranges from 0 to 1. The value of our country is 0.123. Right, the value of our country is 0.123. 0.123. Good. Got my point? These are the new things. How can it is 1/10th? There are 6 indicators. Now do mathematics properly. Don't get confused. Do it properly. 1/3 has to be divided within two things. Again, 1/3 has to be divided between two individuals. Again, that 1/3 has to be divided between 6 individuals. Don't bring all the family members together. One family, 2 children. One more family, 2 children. One more family, 6 children. Don't bring all the families together, all the income together. Abhinesh? It's like mathematics, na? One family, 2 children. One more family, 2 children. One more family, 6 children. They didn't do family planning, no? That is why they're having 6 children. So small compounds, small entities will go to them, na? That is the importance of family planning also. What my point, Abhinesh, Vrinder Sivak. Good. Come to the next, last 25 minutes for this session. The first session, the power play session when we started. This is the last subheading in this chapter. Dailies, qualies and hail. Write down the subheading. Give number 1, 2, 3. 1, 2, 3. Dailies, qualies and hail. Disability adjusted life years. Quality adjusted life years. Health adjusted life expectancy. We'll be discussing this one by one. So can you type these 3 letters for me in the chat so that you won't forget the same thing. I want the familiarity with the subject. That is very important. So I'm making all the possible things so that you'll get familiarized to these words and you won't repeat that mistake in the exam. Something word which will come, it should not feel an alien for you in the exam, because exam is about 19 subjects. So every subject is having their own keywords. Yes. Perfection, yes, not everyone is perfect in every subject, not possible. So it's a mixture of keywords what you need to play in the exam. Daily, can you tell the full form of dailies? Dailies you know better. Good, I know this. Dailies you know. These two things are new updates, what you should know. What is the full form of dailies? Disability adjusted life years. First point you write. Write the full form. Disability adjusted life years. Disability adjusted life years. Yes. I will tell the importance of dailies here. No need to write anything. Everything is summarized in that image. Everything is summarized in that image. Yes. For example, starting from birth till death. Starting from birth till death. That is called as life expectancy. For example, I want to know the burden of one disease like rheumatoid arthritis. I will select one patient of rheumatoid arthritis. Patient will develop disease at this age and will die at this age. So whatever the component the patient is living with, that disease is called as YLD. What is YLD? Can anyone tell what is YLD? Years lived with disability. Don't write anything, I'll make you to write. Just listen and answer my question. Patient is living with disability for that amount of time. That is called as YLD. And patient died at this age. Patient died at this age. But the actual limit was 80. Patient died at 60. The actual limit standard life expectancy was 80. Example. Yes, good. The death happened at 60. How many years of life lost? Answer my question. How many years of life lost due to premature death? Answer this question. Very, very good. Patient died before, na? So how many years of life lost in this patient? Very good. Sir, 80 minus 60, 20. Okay, good. Then you count both the components, YLD and YLL. Good. YLD and YLL. Adding both the entities will give what for you? Answer my next question. Adding YLL and YLD will give what? Dailies in this patient. Yes, good. Dailies in this patient. One more patient, the pattern can be different. One more patient, the pattern is totally different. But the disease is rheumatoid arthritis, what you are checking. Then you'll come to know the burden of rheumatoid arthritis in this population. This is one indicator to express burden of disease. Yes. Dailies include only mortality component, true or false? Think and tell. Dailies includes only mortality component, true or false? Answer my next question. Dailies includes only mortality component, true or false? Yes, very good. True or false? This is the question what I am asking. Dailies includes only mortality component, true or false? False statement, not just mortality, sir. We are adding both the entities. Yes, YLL plus YLD. So that is what the use of dailies, right? The first point to indicate burden of disease. Yes, including both mortality and disability caused by a disease. Yes, mortality is given by YLL. Disability is given by YLD. In dailies, we add both. Copy the points. I'll make you to write everything now. YLL and YLD, we are adding both. Write this first. To indicate burden of a disease. Good. To indicate burden of a disease. To measure both mortality and disability. Mortality is represented by YLL component. Morbidity or disability is represented by YLD component. Years lived with disability. Yes, burden means how problematic the disease is. Na? So now what is the formula for dailies? We are adding both YLL plus YLD. YLL plus YLD. YLL is years of life lost due to death or premature death. Think and tell. This is my next level question. Years of life lost due to death or premature death. This is the NEET question which has been asked previously. So many students have marked death. Only with my notes they have marked premature death because they know the exact thing. What is standard life expectancy? What is Japan and all? Yes, good. YLL is years of life lost due to premature death. This is calculated from standard life expectancy. Japanese life expectancy is taken as standard. Japanese life expectancy is taken as standard. From that we count YLL. Now tell me, YLL is calculated from national life expectancy only, true or false? Again, one more very important question. YLL is calculated from national life expectancy only, true or false? Think and tell. YLL is calculated from national life expectancy only, true or false? False statement. It is from standard life expectancy, that is Japanese life expectancy is taken as standard. Adding both the entity, one daily means 1 year of healthy life loss. This is very important. 1 year of healthy life loss. This is where you make mistake again. 1 year of healthy life lost. Not just life lost, it is 1 year of healthy life lost. Either due to death or due to disability. Either due to death or due to disability. So if I am asking this question, there are two diseases now. Disease A and B. Disease A, 60 days lost. Disease B, 20 days lost. Which is more burden for us? Think and tell. Very easy question I am asking. Two diseases are there. From disease A, 60 days lost. From disease B, 20 days lost. Which disease will be the more burden for us? Which disease will be the more burden for us? A or B? Yes, A is having more burden because more the daily is lost. Obviously, the disease is having more burden. So in public health now, if I'm asking, if I'm funding something, which disease I have to focus more on? A or B? This is the practical question, very easy question I'm asking. Which disease we need to focus more on? A versus B. Like A, if I'm telling mental health, something related to that, schizophrenia and all. B, diabetes, for example, I'm telling. More the dailies, more the focus we need to focus on A compared to B. We need to focus more on A compared to B. Correct. How to calculate dailies? How to calculate dailies? For example, an individual is there. Thoda sa slight calculation you should know. Some fine tuning we have to know in dailies. Copy this question. Mr. X developed diabetes at the age of 45 years. Suffered with diabetes for 5 years. Died at the age of 50. One more information is given in the question. Calculate dailies. This is one extra information. What if you know, you will have an extra edge in the exam. Some examiners, when they want to make the question paper difficult, then they'll frame such questions. Tell me good. Do it properly. Good. First, do years of life lost. 80 minus 50, 30. That is correct. That is easy. First, tell me years of life lost. Years of life lost. 80 minus 50, 30. Good. Very good, Shubham. How you got 31? 31 is the answer. Disability weight is also given importance now. 5 years lived with disability, but with a weightage of 0.2. Not that much burden for us. Diabetes, the patient can live aram se. But if I change the question to blindness, disability weight will change. That will be mentioned in the question. What you have to do is simple calculation. Got my point? 5 into 0.2. This number has to be given importance. That is where you make mistake. If your answering is at it as 35, then you are not giving the respect for the examiner only. Examiner is giving this. Use that number. Got it, Abhinesh? Good. Yes. Slowly, you are making mistakes, you are correcting it, slowly you will improve. That is the way we have to go future, one by one better improvement. Improvement is more. Good. Shubham, correct. Abhinesh, correct. Add both. Now, how many days lost? I want everyone to type this. How many days lost? 31. 31 days lost for this individual. One more diabetic patient, the scenario can be different. One more diabetic patient, the scenario will be different. Slowly, overall burden of diabetes we can calculate by using this. So did you get how to calculate dailies? Disability weight is considered during dailies calculation, true or false? Answer my question. Disability weight is considered during dailies calculation, true or false? Disability weight is calculated or considered during dailies calculation, true or false? True statement. We have to consider disability weight also. Yes, sir. Correct. Now come to qualis. Qualis will tell how good is the intervention. Quantity and quality of life both are combined to tell how good is the intervention given by the intervention, like a new drug or a new vaccine. Right, the first point. If I want to tell my new intervention is good, I have a new cervical cancer vaccine that is giving a better and quality of life also. How we are telling how to express effectiveness of intervention, that is by using this indicator. Slowly you'll understand the application of this also. This is also very easy to understand. Good. First write the point. It will consider two things, quality and quantity. Quality of life is expressed by utility values. Utility value for perfect health is 1, for death is 0. Utility value for perfect health is 1, for death is 0. Write this. Utility value for perfect health is 1, for death is 0. That means utility value ranges from what to what? 0 to 1. If the patient is living perfect health, there is a questionnaire actually. Based on the questionnaire, we can define whether it is perfect health or not. If you are ticking right for all the questions in the questionnaire, perfect health. There is a definition. Now tell me, what is utility value for death? Answer my next question. What is utility value for death? See this question properly. What is utility value for death? Zero. Good. Correct. Very good. For example, I'm telling there is one individual living perfect health for 1 year. Quantity 1, quality is also 1. 1 into 1. 1 quali. Write this word. An individual is living in perfect health for 1 year. So utility value 1 and quantity is also 1. 1 quali. What is 1 daily and what is 1 quali? Definition is very important. What is 1 daily? See the note and tell me good. What is 1 daily? 1 year of healthy life lost due to a disease. What is 1 quali? 1 year of life lived in perfect health by an intervention. Given by an intervention. Yes. If one more individual is living for 1 year but with half of perfect health, some quality wise it is lesser compared to 1. So how many qualities? This was the previous year question again. If you know, there's nothing, very simple way of calculation. Just they want whether you know or not, whether you are exposed to this word or not. That is what the examiner is testing. They just test superficial knowledge, but most of the students will not be knowing this. 1 into 0.5 qualities. Who is living a better life? First individual or second individual? Which intervention is better? Who is living a better life? I am asking. Not just the quantity, based on the quality of life given by an intervention measured using tell me. Tell me good. First one is living a better life. First one is living a better life. What are the uses of police to tell how good is the intervention? How good is the intervention? Effectiveness of two interventions if I want to compare. Then we can use the word police. Police will be used in telling how good is the intervention. A versus B. The analysis is called as cost utility analysis, where you tell how much quality is given by the intervention. That is the output what you are checking. The intervention should give more qualities or less qualities. This is my next question. Which is a better intervention? The intervention giving more qualis or lesser qualis? Think and tell. Again, the same easiest question I am asking. Tell, good. Yes, good, correct. More qualis. For example, I am telling, take this question. Treatment A, treatment B. One disease you are comparing two interventions. One disease we are comparing two interventions. Treatment A, treatment B. Now tell treatment A, years lived. 4 years, utility value is very good, 0.9. 4 years, utility value 0.9. How many qualis given by intervention A? Answer my question. How many qualis given by intervention A? 4 into 0.9. Yes, sir. 3.6 qualis. 3.6 qualis. Come to the second intervention, treatment B. Make a table in the note. Years lived to utility value 0.5. 2 into 0.5. Utility value is 0.5. Utility value is how much? 0.5. So 2 into 0.5. How much you are getting? 1. 1 qualis. 1 qualis. Now tell which is a better intervention. Which is a better intervention. How much extra you are getting? A is better than B. Yes, correct. A is better than B. By using A over B, how much extra qualis you are getting? How much extra qualis you are getting? This is my question. Extra 2.6 qualis gained. Extra 2.6 qualis gained. Got my point? Extra 2.6 qualis gained. Ah, yes, Abhinesh, very good. Treatment is better. Extra 2.6 qualis gained. This is how you have to know what is the use of qualis, how you are interpreting qualis. Got my point? Did you copy the example what is shown there? I want the notes to be complete. Good. I want handwritten notes in a proper way like I am showing there. That will be more easy for revision also. Good. 2.6 qualis gained extra. Correct. So same example was given. No need to copy this image. No need to copy this image. Treatment A 4 years into 0.9 3.6. 3.6. Treatment B 2 into 0.5 1 quali. The difference if I am shading there, how much of extra qualis you are getting? I want again everyone to answer. If I am shading this portion, if I am showing the shaded portion, don't copy this graph. Already written the example. No need to copy the graph. Already the example is written in the same way. Now tell me how much extra qualis you are getting. How much extra qualis you are getting? If I am showing what is there in the shaded portion, what is there in the shaded portion? How much extra qualis you are getting? 2.6. That is the answer. 2.6 qualis gained. 2.6 qualis gained. Correct. Come to the last part, that is health adjusted life expectancy. Means number of years an individual can live in a country in full health. This is the word. Highlight the keyword properly. Number of years lived in full health. Average number of years lived in full health. For example, something will happen in between that has to be subtracted actually. That is the way. This is the life expectancy. Some negativities which is happening here. Some negativities which is happening here. That will be subtracted. Physical ill health, some mental disabilities, arthritis, all these things will be subtracted. So whatever is left out is counted. Whatever is left out is counted. This is the counting the portion whichever is left out. Health adjusted life expectancy, counting only the positivities. Now answer my question. If the burden of disease is more, positiveness will decrease or increase? Answer my question. If the burden of disease on a country is more, health will be more or less? See these words properly. The burden of disease is more. Good. Burden of disease is more. Increasing. The amount of full health or perfect health will decrease. Yes, good. Country health status is not good, burden of disease is more, health will be less. So these are the things what you should know. Previously what we used to have this word, these disabilities you are subtracting, these disabilities what you are subtracting. The previous word what we used was disability free life expectancy. That was the old word used now. We are not using those words. Sullivan's index. That was the older word used. Disability free life expectancy. Bracket you write Sullivan's index. Disability free life expectancy. That has been replaced now totally by disability adjusted life expectancy. That has been replaced totally by health adjusted life expectancy. What we have is this now. Write down the sequence. Previously it was disability free life expectancy. That has been replaced towards disability adjusted life expectancy. Now what we are having is health adjusted life expectancy. Now what we are having is health adjusted life expectancy. So if I am asking this word, disability adjusted life expectancy has been replaced by, what is your answer? Previous year question. Disability adjusted life expectancy has been replaced by, what is your answer? Disability adjusted life expectancy is replaced by, what is your answer? Health adjusted life expectancy. Very good. Health adjusted life expectancy. For males how much? For females how much? That is what you have to count. In a given country, for males how much? For females how much? Depending on their morbidity patterns also. Write this. Age and sex related mortality, morbidity patterns, everything is considered. How much males will suffer, how much females will suffer. Then we count their health adjusted life expectancy for males in India, for females in India, if I am asking this question. Good. Now if I am asking one more important word, health adjusted life expectancy is equal to life expectancy. Think and tell true or false. Health adjusted life expectancy is equal to life expectancy. True or false? True or false? True or false? Good. False statement. It is not equal. It cannot be equal. We have to suffer. थोड़ा सा मतलब physically or mentally we are suffering, obviously that is life, and we are subtracting that. Whatever is left out is counted. Health adjusted life expectancy will be lesser than life expectancy. Keep this in mind. Will be lesser than life expectancy. Will everyone agree on this point? Yes or no? I want agreement now. If you are agreeing, put one smiley in the chat box. This is the symbol for agreement I am asking. Good, because we are about to finish the session in 3 minutes. So will you agree on this last statement? If yes, put one symbol like that. Good. And I will also put one smiley so that you are also showing some agreement in this statement. And we will summarize this chapter to summarize the first power play session. Good. The first power play session. And the first, initially the subheading what we discussed was rate, ratio and proportion. The first example, rate, ratio, proportion with their examples. The second was total 5 mortality indicators. Total 5 mortality indicators. Total 5 mortality indicators. Important. Life expectancy, crude death rate, specific death rate, proportional mortality rate, and case fatality rates. Good. Then morbidity indicators, question on incidence and prevalence. How to calculate, what is that equation what we discussed, P is equal to I into D. That equation related questions are very important. Then total 3 index. What is the mnemonic? What is the mnemonic? HDI kill, PQLI L, and MPI multidimensional poverty index L. Good. Then the last was how to differentiate. One is for burden of disease, the other is for effectiveness of intervention, the third is for overall population health. Positive status, if I want to count, we go for HAIL. So these are the things what I discussed in first chapter. My target was to finish the session by 4:30. So this is how we have to summarize the session. And did you copy all the points which I have mentioned in the first session? Tell me yes or no. Because some students joined late, but they'll be getting the recorded session, I think. So now tell me, with your permission, can we take one break of 15 minutes so that the next chapter will become very easy for us. The next chapter will become very easy. So the next session after a break of 15 to 20 minutes. So 4:50, I will start the next chapter. I will start the next chapter. This chapter is very easy compared to the next chapter. So take a break of 20 minutes, 4:50, and the next break is at 6:45. So the next session, the next chapter needs almost 2 hours. After this, then we'll start after the break of 15 minutes. The last session will be from 7 to 9. So this is the plan for today. This is the plan for today. So take a break of 20 minutes. Try to involve with the teacher in the chat box. At last, after finishing the subject, you will come to know how much I recall, how much I can remember easily because of this chat what the students is interacting with the teacher. Na? Good. Take a break of 20 minutes. Good. Very good. It was very good interaction. We are starting the batch from PSM this year. So the session was well and good. All the best. Take a break of 20 minutes. Good.